So first we're going to talk about gastrointestinal diseases, specifically ulcerative colitis and celiac disease. First we're going to talk about ulcerative colitis, or UC. Ulcerative colitis is caused most likely by something involved with genetics, because if you have a family history of it, you are more likely to have ulcerative colitis, and immune system malfunctions and age also play a role. And what ulcerative colitis does is it leaves ulcers in your digestive tract and affects the innermost lining of your intestine. Symptoms for ulcerative colitis are belly cramps and pain, diarrhea, fever, smaller appetite, weight loss, fatigue, and failure to grow. And this will be the case for every disease we talk about today. All of these treatments, none of them are cures. They are just things that help you manage your condition so that you're not in pain constantly. So for ulcerative colitis, these management tools are anti-inflammatory medications, avoiding certain over-the-counter pain relievers, and immunosuppressants. So I interviewed a friend of mine who has ulcerative colitis, and they said the cause of my condition is unknown, but the symptoms were bad stomach pain and feeling nauseous and throwing up a lot. I think if I had to give advice, it's that there are good and bad days, and diet affects it more than you think. So next we are going to be discussing celiac disease. So celiac disease is an immune reaction to eating gluten. You are more likely to get celiac disease if a family member of yours has celiac disease or dermatitis herpetiformis, if you have type 1 diabetes, Down syndrome, Turner syndrome, Addison's disease, or an autoimmune thyroid disease. So symptoms of celiac disease are diarrhea, fatigue, weight loss, bloating and gas, abdominal pain, nausea and vomiting, and constipation. The only effective thing you can do to manage celiac disease is avoid gluten, but there are some people who are so sensitive to gluten that any small bit of it, because even though something's gluten-free, there might still be a tiny bit of gluten in it, even that might trigger a reaction for some, so they might take anti-inflammatory medications or certain vitamin supplements to help them manage these reactions. I interviewed someone with celiac as well. She said in May of 2017, I had been sick for 4 years. I was in Afghanistan. They thought it might be a parasite. My first symptoms in 2013 were vomiting and heartburn. I have faced people not believing my disease or not understanding the severity of it. I have to plan for things that most people don't need to think about. Those who have been recently diagnosed need to understand your own disease and realize that your family understands more about your disease than you think. So now we're going to be talking about autoimmune disorders, specifically lupus, juvenile idiopathic arthritis, and sickle cell anemia. So first we're going to be talking about lupus. So lupus is when your body's immune system attacks its own tissues. It is more common in women. It's often diagnosed in people between the ages of 15 and 45, and it's more common in people of color. Symptoms of lupus, as you can see, there are many of them, specifically fatigue, fever, joint pain, stiffness and swelling, a butterfly-shaped rash on your face, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and even memory loss. And the thing about diseases like this is you will face people thinking you're just faking the entire disease for attention, or that it's not as bad as it is because you don't look sick. But in reality, this disease is so serious, it causes memory loss. So treatments for lupus are anti-inflammatory medications, anti-malarial medications, immunosuppressants, and steroids, all to reduce inflammation so that your joints won't hurt as much and to try and avoid another infection or fever or flare. So I interviewed a family friend of mine that has lupus. This person pretty much taught me how to be differently abled, all the stuff you don't really think about or you wouldn't think about right away, like how to deal with rosacea. I have really bad rosacea all over my face, and this is the person who taught me about green color correcting and let me know that certain companies make foundations for people with redness prone skin, stuff like that. She even introduced me to spoon theory, which is something we will talk about later, so if you see references to that right now, don't worry, we will go over it. This person said, I've been suffering from lupus for 17 years as of January of 2020. Originally, they thought I had Lyme disease. After 2 months, I was still not improving and was hospitalized, where I was diagnosed with lupus. People generally do believe me when I say that I am sick. They are just shocked. I relate to spoon theory more on some days than others, but I definitely do have to budget my energy. My advice to someone that has recently been diagnosed with lupus would be to know that while yes, you are limited, you can still do a lot of things. It just might take you more time. That's the sentiment that has led to the term differently abled. If your friend has recently been diagnosed with lupus, my advice would be to be a positive force in their life. Even if they look horrible, tell them they look beautiful. If they can't do some of the things that you used to do together, let them know that it's okay. So next we're going to talk about juvenile idiopathic arthritis, or JIA. We don't really know what causes JIA. In fact, that's what idiopathic means, is we don't know the cause. We do know that JIA is more common in girls. It is the most common form of arthritis in children under the age of 16, and it causes persistent joint pain and swelling. Symptoms are, shocker, joint pain and swelling, as well as stiffness, fever, swollen lymph nodes, and rash. Treatments for JIA include steroids, anti-inflammatory medication, and anti-rheumatic medication. I interviewed one of my Girl Scout leaders who actually has rheumatoid arthritis, which is kind of the counterpart to JIA. She said, my symptoms started in 2001 after the birth of my first child. My joints began to swell, I had fatigue, and had trouble walking. I've dealt with people not believing I am sick, mainly my parents and coworkers. I do identify with spoon theory. I feel like I have to plan constantly just to do normal things. My advice for people who are newly diagnosed with rheumatoid would be to rest and don't try to overdo it. So now we're going to talk about sickle cell anemia. So sickle cell anemia is having abnormal hemoglobin cells, which cause red blood cells to become rigid, sticky, and misshapen, and that the shape of the red blood cells causes a lot of other issues. But this abnormality is caused by a genetic mutation that both the mother and father would have to carry, and this is much more common in African American communities. So, symptoms. Anemia leaves you with too few red blood cells, and because of the shape of these red blood cells, it will cause periodic episodes of pain, as well as swelling in your hands and feet, and other joints. It will also cause vision problems sometimes because of the way the blood cells are shaped. Not as many might get through to your eye as your eye needs. It might also cause delayed growth or delayed puberty, and it also leaves you immunocompromised, so you would have a lot of infections if you had sickle cell and you weren't proactive with your treatments. So for treatments, you can take pain relievers to manage it when you do have pain flashes, and you can take medications that reduce the frequency of these pain flashes. And then to deal with you being immunocompromised, many people with sickle cell take antibiotics as a daily medication to prevent infections. There are much newer treatments that actually work to treat the root cause of sickle cell, which is the genetic mutation, and that's stem cell transplant. This is actually really cool research. If you're interested in this type of stuff, I would encourage you to look it up. So next we're going to talk about neurological diseases. Right now in this section we're going to talk about multiple sclerosis and fibromyalgia. Migraine kind of has its own section because it's the most common disease we're going to be talking about, and it's the disease I was diagnosed with first, so I can go on about it for quite a while. But first we're going to talk about multiple sclerosis, or MS. So multiple sclerosis is a disease of the brain and spinal cord, and it occurs when the immune system attacks the protective sheath that covers the nerve. It's most commonly diagnosed in women between the ages of 16 and 55, and in people who are white. Certain things such as vitamin D deficiency or a family history of MS also put you at higher risk. Certain diseases have also been known to trigger it, as well as climates that you live in. And if you have autoimmune disorders or you smoke, you're also at higher risk. You'll see, you might have noticed, or you will notice, that with a lot of these diseases, other diseases put you at higher risk to get them. So a lot of people who are differently abled have multiple diseases. These are called comorbidities. And once you have one condition, especially if it's autoimmune, you're more likely to get others. So the symptoms of MS are limb weakness, electric shock sensations caused by certain neck movements, tremors, vision problems, slurred speech, fatigue, dizziness, or tingling or pain in parts of your body. And things like the slurred speech or tremors make you look like you're drunk, because that's the only very outward sign. There have been people with MS who have been arrested for using a handicap space, arrested for being publicly drunk, even though they weren't. They just have MS, and they were in public trying to get groceries and exist as a human. Or stuff like that happens very, very frequently, as you'll see, because I interviewed someone with MS. But first we're going to look at the treatments. So there have been more treatments in recent years for MS, specifically beta interferons and plasma exchange are newer treatments for MS, but corticosteroids and immunosuppressants are also commonly taken for multiple sclerosis. So I interviewed a family friend who has MS. I actually remember when she was first diagnosed with it because I was only 6. She said in 2009 I had a weird numbness in my legs and feet. 2 months later I felt numb all the way to the waist. I've been questioned for using handicap parking. Somebody actually told me that I could not be sick. I occasionally feel self-conscious using accommodations. Little side note, that is definitely something I relate to. I always feel anxious just trying to use the elevator. Feel like I'm being judged because I look normal. She continued saying, I'm constantly planning how I can do things to avoid another flare-up. My advice to newly diagnosed people would be to be patient and generous with yourself as you adjust to your new reality and look at new research and try to be optimistic. So the last thing we're going to talk about in this section is fibromyalgia. So fibromyalgia has a definite genetic component, and certain things have been known to trigger it. Certain infections, PTSD, and rheumatic diseases have been shown to trigger fibromyalgia. Fibromyalgia causes widespread pain, fatigue, sleep issues, and mood swings. So the symptoms of fibromyalgia are a widespread diffuse pain. It's often described as a constant dull ache, and it occurs anywhere on the body. Other symptoms include headache, sleep disturbances, fatigue, pain or cramping in the lower abdomen. Some report cognitive impairment, depression, and anxiety. So keeping specifically the depression and anxiety and keeping those last few symptoms in mind, let's look at the treatments. So the last three specifically are the ones I like to think of as pretty counterintuitive treatments. So their suggestion for a disease whose one of the hallmark symptoms is sleep disturbances is sleep. Stress reduction, but one of the hallmark symptoms is anxiety. And life is already stressful. You add on a chronic illness, it gets even more stressful. And then exercise. It's hard to motivate yourself to exercise when you're able-bodied, let alone when your body just always hurts. But there are some more, I would say, more legitimate treatments like antidepressants, pain relievers, and anti-seizure medications. You'll notice that it's a running theme with if they don't know what's to do with certain neurological conditions, they'll prescribe anti-seizure medications or antidepressants. The same is true for migraines, at least. So this is a statement from someone who has fibromyalgia. She said, I was 17 and had been living with my diagnosis for about a year. I was dealing with symptoms such as lack of concentration, tingly fingers, never-ending fatigue, extreme pain, pain points, and social isolation. I was constantly hearing, but you look so good. And on that note, that's where we're going to end this section of my presentation. When you have time, next you will be listening to more information about migraines. Thank you.